Hi, Wisconsin. Governor Tony Evers here.
And I'm Lieutenant Governor Mandela Barnes.
We wanted to take a moment today to thank you for wearing a face covering or a mask whenever you are out and about.
Your good work can save lives. As we know, face coverings and masks are effective tools to stop the spread of COVID-19.
That's right. And we wanted to share some tips to make wearing your mask even better. First of all, wear your mask whenever you are indoors in a space that is not your own home.
Second, wear a mask anytime you're around others who you don't share a home or a living unit with.
Next, always wash your hands before and after putting on or taking off your mask.
And remember, not to touch it or move it around without washing your hands.
And finally, a mask or face covering is not a substitute for physical distancing. Please continue to maintain 6 feet of distance between you and anyone who is not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Hi, I'm Pat Connaughton with the Milwaukee Bucks. I want to show you some things that I do to stay resilient during COVID-19. Resilience means learning how to bounce back, be strong, and be supportive. Staying in touch with family and friends is good for you and them. Stay connected. Even though it's more difficult to do right now, it's still important.
Hi, Wisconsin. Governor Tony Evers here.
And I'm Lieutenant Governor Mandela Barnes.
We wanted to take a moment today to thank you for wearing a face covering or a mask whenever you are out and about.
Your good work can save lives. As we know, face coverings and masks are effective tools to stop the spread of COVID-19.
That's right. And we wanted to share some tips to make wearing your mask even better. First of all, wear your mask whenever you are indoors in a space that is not your own home.
Second, wear a mask anytime you're around others who you don't share a home or a living unit with.
Next, always wash your hands before and after putting on or taking off your mask.
And remember, not to touch it or move it around without washing your hands.
And finally, a mask or face covering is not a substitute for physical distancing. Please continue to maintain 6 feet of distance between you and anyone who is not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality. Please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phones. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea Palm. Also available to answer your questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases, and Ryan Nilsesdoon, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon and welcome back. Thank you for joining us today. I warned last week that we are reaching a new and dangerous phase of the COVID-19 pandemic here in Wisconsin. Since then, Wisconsin saw 4 days in a row with a daily increase of more than 2,000 positive COVID-19 tests a day. And we had a single-day record of 2,817 cases reported on Saturday. As you know, last week I issued a new face coverings order to help us try and contain this virus and stop the spread. I know many of you across our state are staying safer at home, limiting travel and social interactions, and wearing a mask whenever you are out and about. And I want to thank you for doing that important work. But I also know that there are many across the state who aren't taking this seriously, who aren't wearing masks, who aren't limiting their travel, who are going about their daily lives as if though it is November of 2019. Well, folks, it's not November 2019. It's not January or even March 2020. We are 9 months into this pandemic, and right now it's not slowing down, it's picking up speed. We have got to put the brakes on this pandemic. And yes, it starts with wearing a mask whenever you are out and about. But we also need folks to understand that wearing a mask is not a substitute for social distancing. It's not a substitute for limiting exposure. And it's not a substitute for staying safer at home. So today, I want to be crystal clear. If we're going to get this virus under control, then wearing a mask is the absolute least we need you to do. If you're planning to host a backyard barbecue with your extended family or a group of friends, please reconsider. If you're planning an event for your community or organization, please host it virtually. If you're hosting a watch party for a debate or Monday Night Football or the Brewers playoff games, please keep it to your close circle of 5. If you want to get out and about and support a local restaurant, enjoy it outside while wearing a mask or grab it to go. Skip the play dates, the dinner parties, the family get-togethers, and work conferences, or any other gatherings with people you don't live with for the time being. And wear masks whenever you are around folks that you do not want to live with. Over the last few weeks, we've seen an increase in people carrying on business as usual, hosting parties, hitting the bars, and heading to weddings. Folks, it isn't safe. This virus is real, and it's devastating our communities and will continue to do so until we all get on the same team. We cannot allow this virus to go unchecked, and we have to take steps quickly to flatten the curve and to stop the spread. We have to get back on track and make sure this virus doesn't cause any more setbacks to our economy and communities than it already has. 1,283 Wisconsinites have lost the battle against this virus. Those are our moms, our dads, our grandparents, best friends, co-workers, community pillars, and loved ones. And hundreds of thousands more have been lost nationwide. I cannot stress this enough. No party, no bar, no gathering is worth it. We owe it to those struggling with the loss of a loved one, to those who are working in our healthcare facilities caring for the sick, and to our most vulnerable neighbors who are at high risk, to do the best we can individually every day to stop the spread of this virus. I know this pandemic has been tough on everyone, mentally, emotionally, physically, financially, but we have to be patient and we have to work together. Thank you for every dinner you've done takeout rather than dine in, every party or celebration you've canceled, vacation you've postponed, event you've made virtual, and every effort you've made to keep your friends, families, employees, and coworkers and neighbors safe so we can get through this pandemic together. Our resilience is a trait I've seen everywhere Kathy and I have lived in our state and every place I visited. I know that we will get there if we continue to put the health, safety and well-being of our neighbors first, as we always do. And now I'll turn things over to Secretary Designee Andrea Palm. Andrea?
Thanks, Governor. Good afternoon, and thanks for joining us again today. Today I'll start with the numbers. There are now 119,955 confirmed cases of COVID-19 here in the state of Wisconsin. That's an increase of 2,367 over yesterday. Our total deaths have now reached 1,300. That's 17 more than yesterday. As Governor Evers just reminded us, these people we have lost are our friends, our neighbors, family members, and co-workers. We've lost too many during this pandemic, and as we see a significant surge here in Wisconsin, we must take action to change course. Earlier this month, the surge in Wisconsin was concentrated among young people, as we experienced significant case increases in communities with college campuses, particularly linked to their social gatherings. In fact, in early September, 18 to 24-year-olds had a case rate that was almost 5 times higher than any other age group. However, we are currently seeing a shift in our data. 18 to 24-year-olds have decreased their case rate, but other age groups have not, and we continue to see an overall increase in our cases. Today, our 7-day average of new daily cases is 2,255, up from 684 1 month ago. With this surge in cases, our healthcare system is feeling the strain. And today, DHS is taking action to help increase their capacity by increasing workforce flexibility and expanding Medicaid reimbursement for post-acute and off-campus hospital outpatient locations. These are actions we took earlier in the pandemic and are taking again now under this new public health emergency. There are other actions we are looking to take to further assist our hospitals, but we need every Wisconsinite to help as well. As contact tracers are working hard to follow up and learn more about our surging case counts, we hope to better understand the potential reasons for the increase in cases across age groups to inform additional steps we need to take. To support them in their work, please remember that contact tracing is about gathering information that is necessary to protect people's health. For close contacts of a positive case, contact tracers are able to share information about your potential exposure and direct individuals to the resources they need for testing, quarantine, and isolation. And for communities and the entire state, the information provides a picture of how the virus is spreading here in Wisconsin. That's why it's so important to pick up the phone and answer the contact tracers' questions as thoroughly and truthfully as possible. Because the reality is that we know the virus is spreading in Wisconsin. It's up to each of us to do our part to slow that spread. If you get a call from a contact tracer, answer it. If you have symptoms or have been exposed to COVID-19, get a test. We all need to wear a mask. Avoid gatherings, and that means staying away from large crowds and small groups of people if they are people that you do not live with. Stay home as much as possible. Practice physical distancing. Wash your hands frequently. We slowed the spread before because we all acted together, and now is the time to do it again. We owe it to our friends and neighbors, our family members, our co-workers, and to ourselves. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And in the interest of time, please only one question per reporter per outlet. And we'll begin today with Scott Bauer of the Associated Press. Scott?
Hi, thanks for doing the call. Governor, you've said in the past that you were unwilling or maybe unlikely to do another statewide order to close K-12 schools. Given the surges we're seeing, are you reconsidering that, or are you still going to let school districts decide whether to stay open or not?
Yeah, and I will say, and maybe the health experts may have some additional. Yes, we're seeing obviously some cases in our schools, but that is not the majority of what we're seeing that's driving this. And school districts are doing a good job if it's causing a significant interruption in the education, they're going virtual or remotely. So I still support their ability, but people have to recognize this isn't just about the schools. We're operating under community spread here, and we can solve this with the tools we have in place.
Thank you, Scott. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yes, thanks for taking my question. President Donald Trump has announced 150 million rapid COVID-19 tests are going to be shipping out for states. My question is Wisconsin going to be getting any of those? And if so, how much are they getting? And if so, who are they going to be used on? Thank you.
Yep. Thanks for that question, Rob. A couple of things. I think we believe our allocation will be somewhere around 2 million of those antigen tests. As we have said throughout this outbreak, one of the strengths of the testing system we have built here in Wisconsin is its diversity, and these antigen tests will help, will further help us diversify the kinds of tests that we have at our disposal here in Wisconsin. I think the thing that folks need to appreciate, and I, if Dr. Westergaard wants to say more about this, I certainly would welcome it. But antigen tests are not the PCR tests that we're using most frequently here. Antigen test is a new tool in the toolbox, and so they have different strengths, different weaknesses, different kinds of scenarios they should be used in, that they're most effective in. And so Ryan and his team and other experts at the department are currently working through and thinking through how to deploy this new federal asset, which we are certainly grateful to receive, to make sure that it is used in the most effective way, considering, again, its strengths and weaknesses. But we do want to continue to diversify the kinds of tests that we have access to here in Wisconsin, considering that the supply chain continues to be fragile, and so we need to have as many options as we can bring to bear to make sure we can keep testing at a pace that we need to.
That sounds good. I think the biggest advantage of them is, of course, a shorter turnaround time, and they've been studied in people who have symptoms and can give us a rapid result. So the likely areas where those make the most difference are outbreak settings, places like schools and long-term care facilities, where knowing relatively quickly can allow us to do isolation. So it's a valuable resource that we have to use in the most strategic way we can. And there'll be also a lot of training for people to use these in a different way than we have in the past.
Thank you, Rob. Now to Emily Davies from WSAW-TV in Wausau. Emily?
Hi, thanks so much for taking our question. My question is regarding a discrepancy that we noticed in some of the data on the DHS website. So, for example, on September 27th, it says 17,000 total people were tested for COVID, and then it says 1,452 people were tested positive, and 7,462 people tested negative, which is about 9,000. So can you explain the discrepancy between that 9,000 and 17,000 total people tested?
Mm-hmm. I think we would be happy to make sure that we're looking at the same thing that you are looking at, but I assume the discrepancy you're seeing is between the total number of tests as opposed to the number of people tested, right? We have both of those graphics on the website on that summary page, I think maybe where you're looking. And so as this pandemic has gone forward, right, we have deployed a number of strategies to do retesting in places like nursing homes and in other vulnerable congregate settings. And so the longer this goes on, the more likely you are to have a person get tested multiple times. And so both the number of unique people tested as well as the total number of tests are displayed. And I assume that is the difference in the numbers that you're looking at. But again, would be happy to make sure we get somebody on the phone with you so that we're all looking at the same charts and are totally understanding what you're looking at and get you the right answer if my answer is not right. But I think that's what you're looking at.
Okay, thank you, Emily. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. So the co-chair of the Joint Committee on Finance, he's criticized the DWD for not requesting funds to address the outdated unemployment system, which has been attributed to the backlog in claims. He's also said that if a request were to come in, that he would evaluate and consider it. I was just wondering if you had any response to that criticism, but also if you would take him up on that request for funding and update, to update the COBOL-based system.
Yeah, Representative Nygren knows that what the different agencies put together may look different in the end. That's the way it always works, because we cut some, we add some things to it. But in this specific case, the agency did put information that they will be submitting something about updating the UI system. It's right in the document. And it didn't say what it is because they're in the process of evaluating it. And I am really happy to have Representative Nygren behind this, because we desperately need it. We needed it in the past, and we'll be looking forward to having a more robust and reliable system in the future with his help.
Thank you, Mitchell. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hello, good afternoon. Thank you again for taking the call. President Donald Trump is set to have two back-to-back events, one in La Crosse and one in Green Bay on Saturday with expected large crowds. Is there any preparations or any preliminary actions that can be done ahead of time to prepare for what could be a super spreader event if that indeed does happen? Thank you very much.
Yeah, absolutely. The president could do things. One is maybe not come. These two municipalities and cities are ranked right up towards the top of all the places in the country to go to. So that's number one, he could not come. The second thing that could be done is for him to insist that if people are there, they wear a mask. He can make that happen. He could wear one too. But those are the two things that he could do to make sure that it doesn't become a super spreader event.
Thank you, Victor. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking the question. Is there evidence, as the virus is now spreading among older age groups, is there evidence of more serious symptoms increasing as a result? And also, do you have any theories as to why it's spreading among the older age groups, like maybe exposure to asymptomatic younger adults or some other pattern? Thanks.
Yeah, I'll let Dr. Westergaard weigh in on this as well. I think we are seeing it spread among all age groups, and I think the rising number of hospitalized patients suggests that it is those more susceptible to more severe disease that it is being transmitted to by the result of their hospitalization. But I think it's important to recognize that with the kind of community transmission we are seeing, it is not surprising that it is spreading in all age groups, and that now really is the time to make different choices about our actions and our activities, and make choices closer to the kind of choices we were making in March and April than the choices we have been making the last couple of months. And those are really important actions that we can take individually to protect those older age groups and those who are most susceptible to severe disease. But Dr. Westergaard may have dug into the data a little more specifically.
Well, I think the biggest evidence that it is increasing in severity illness is the hospitalization number. And I think all of our regions are showing increased hospitalizations related to COVID-19 and in general. So I think the answer is yes, that the more severe cases are on the rise. And I think the other thing I'd just highlight is we're we need to be less focused right now on outbreaks and clusters. We talk in epidemiology, we talk about localized epidemics versus generalized epidemics. And what we have now in Wisconsin is a generalized epidemic. We've exceeded the capacity of local health departments to to do contact tracing to everyone who needs it. This is important for people to understand. The way that we stop transmission chains are to find clusters and say, who have you been in contact with, and then give those people recommendations about isolation and quarantine. The level of transmission we have right now is outstripping our ability to do that, which means that it's safe to assume that the virus is everywhere. So everyone needs to change their behavior, not only if you've been told that you've been in contact with someone, because when the virus spreads to this degree, we lose the fine-tuned information to know exactly where we are. So in a generalized epidemic, it truly puts everybody at risk, and that's what's translating into higher cases in all age groups right now.
Thank you, Eric. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. A number of healthcare providers are reporting that staff are being quarantined due to the possible exposure to COVID, and that could have an impact on their ability to provide care. Can you elaborate on the flexibilities that you're giving them today, and what other sort of avenues is the state looking to support in that area? Like, are you planning to use CARES Act money to bring in out-of-state providers to help, or deploy a National Guard, or operationalize the alternative care facility? Thank you.
Yeah, Sean, I think certainly we want to have all of our options on the table. It's important that we do everything we can with our hospital partners to make sure that the staffing shortages that they are seeing and will likely continue to see are addressed in ways that allow them to take care of the patients in their care. And so, there are a variety of things that we deployed in the first public health emergency back in the spring that we are looking at, some of which we have taken action on, others which we continue to evaluate. But I think all of it's on the table. We are in active discussions with our hospital partners about what would be helpful and how to execute on those items. As it relates to the alternate care facility, I think that is why we built that as the ultimate insurance policy, right? In the worst case scenario, the scenario we hope we never get to, but that we are closer to getting to than we ever have been. And it is why you hear the urgency from the governor and from me about needing to take actions individually that slow the spread of this disease. And this is a really critical moment to do that, because if we wait until we need that alternate care facility, we have waited too long. And so our goal is to get to a place where we still are using that alternate care facility as an insurance policy, that it is a worst case scenario that we never get to because we all double down together and prevent it from happening. But it obviously is an option for us should we need it, and we have clearly communicated to the hospitals that we need about 4 to 7 days warning for if they are going to need to surge patients out of their hospital into the alternate care facility, and we are prepared to stand it up and staff it and have it operational to be the backstop should our hospitals exceed their capacity. But again, our goal should be never to get there. And we have to do the things now over the next week to 2 weeks to prevent that from happening.
Thank you, Sean. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, thanks for taking my call today. My question is for Dr. Ryan Westergaard. You mentioned that the antigen tests from the Trump administration could be used in a school setting. Will that quick turnaround time that the antigen tests allow, will that allow for schools to stay in person rather than virtual?
Yeah, thanks for that question. It's educational settings is one of the settings that people hope that this type of technology could be useful for, but it has not been used in these settings to a large degree for a couple of reasons. The first is that the FDA authorization for these was used in people aged 22 and older, so it hasn't been studied extensively in children. The other issue is that these are rapid tests, but they need to be used in a setting that has either been certified by the federal government as a laboratory meeting certain standards, which is called CLIA, or received a waiver. So there are few schools in Wisconsin that have the appropriate training and clearance to use these. So I think it's unlikely that we'll be able to rapidly scale up use in school settings, although those are types of settings that really would benefit from rapid turnaround testing. So this is a project that's ongoing. We need to understand how can we make use of these new tools in a flexible way. But I think it's going to be, not an immediate benefit to schools until we figure out some of the operational challenges about how we use them in these settings, because they do provide rapid tests, but they still need to be in a laboratory or a laboratory-like setting, which most schools don't have. But in the principle, being able to give a rapid test, it would very much be useful in that, but we still have some work to do in order for that to be something that is really beneficial for keeping schools open.
Thank you, Stephanie. Now to Monique Lopez from Fox 11 in Green Bay. Monique?
Yes, thank you. After reviewing the DWD audit, my question for Governor Evers is, why didn't you step in sooner?
Well, I didn't know. Oh, okay, I'm sorry. I thought you were going to continue on with the question. My point was that I was very hopeful that that they would be able to reduce the waiting period. We had talked about a goal to get it down to close to zero as possible in August, and it didn't happen. And so we made the change at that point in time, or shortly thereafter. And I feel very confident that what is going, we're making the changes that the auditor suggested as far as defining what is an unanswered phone call. An unanswered phone call is an unanswered phone call. That doesn't necessarily change the fact that people weren't getting the services they need. So we've made that change, but we've also put in a leader now, at least temporarily, from the Department of Corrections, and her job is to troubleshoot the system, making sure that everything's in place and make the changes necessary to get us to a better place. And Deputy Bahacek is doing a great job in that category.
Thank you, Monique. Now to Shemaine Mills from Wisconsin Public Radio. Shemaine?
Thank you. Governor Evers, we currently have a statewide mask mandate, but you and others have urged individuals to take other precautions against coronavirus. I'm wondering, is there anything state government can do beyond the mask mandate, either unilaterally through your administration or working with the legislature?
Well, we'd love to work with the legislature. They haven't been around for a while, and frankly, last time we brought that up, about a rule change to mitigate some of these things. They indicated no interest, and in fact, even with this most recent mandate that we're having across the state, the Republicans and their allies are now suing us in court to stop that from happening, because apparently they don't feel it's a good option for the people of Wisconsin to remain safe. So that all aside, if they have some good ideas, let's have at it. But in the past, they were very much opposed to that. And if you cut right through it, the issues around wearing a mask, being socially distant, making sure you're not going into small places where there's a whole bunch of people not wearing a mask, all that's the basics. Whether we had agreed on all those things or not, those are still the basics. People in Wisconsin know they are the basics. Republicans know they're the basics, and certainly I know that. So we are counting on goodwill of the people of Wisconsin to make those changes, but we continue to look at other ways to make this even better. A small example, I was very proud of the fact that retailers, especially large retailers in our state, made a commitment to their customers many of them did, that their customers that they would enforce mask wearing in their stores. And it would be great help for us if they reinforce that once again. I know it's been several weeks and months since that originally happened, but every reminder helps, and those retailers could do a great service to the state of Wisconsin if they made that reminder once again.
Thank you, Shemaine. Now to Will Cushman from WisContext. Will?
Good afternoon. My question is for Secretary-Designee Palm and/or Dr. Westergaard. The UN Secretary General responded to the global COVID-19 death toll surpassing 1 million yesterday by alluding to the role of conspiracy theories and contributing to the toll, saying, quote unquote, misinformation kills. As COVID-19 surges in Wisconsin, we're hearing about many people abandoning or ignoring public health advice meant to slow transmission, like staying home and wearing masks. And at the same time, we're aware of misinformation about the disease being rampant on social media and talk radio in Wisconsin and other venues as well. So my question is, what role, if any, do you think misinformation is playing in Wisconsin's surging COVID-19 outbreak? And are you hopeful that Wisconsinites who have perhaps bought into conspiracy theories that the disease is not as serious as you say it is, will come back around to taking the virus seriously? Thank you.
Thanks, Will. I think, misinformation and sort of this is our first major outbreak like this in the world of social media and Facebook and other sorts of vehicles that spread misinformation, even in ways that are unknown to the sharer of that information. Sometimes it's inadvertent, but it certainly facilitates a lack of facts, and it's why we have tried at DHS to be clear about the science, to be consistent about what we're hearing, what we're learning as this has evolved, because it certainly is not exactly the same as it was at the beginning. But we need these trusted sources of information: the CDC, DHS. Our scientists more broadly, we need to allow them to be clear about what we know and the guidance that stems from that extends from that, so that we can all do the things we need to do to stop the spread. And so I think it is a new wrinkle in the way we do our work as a public health agency, and we're doing our best through our marketing campaigns and through things like this media briefing and other avenues of Facebook Live and other avenues that we have to make sure that we get the facts out there, so that folks have a trusted source, a place to go to understand where we are, where we're headed, and what they can do to help. But make no mistake, this is serious. We are at a critical moment here in Wisconsin, and now really is the time for folks to adhere to the good public health tools that we have been talking about from the beginning. As you said, Will, the mask wearing, the hand washing, the physical distancing, keeping to your family, keeping home as much as possible. These things are choices we all really need to make now to stop the spread.
Thank you, Will. Now to Jonathan Neiser from NBC 26 in Green Bay. Jonathan.
Yes, thank you for taking the call. The former CDC director, Dr. Tom Frieden, has said that test results older than 72 hours are useless. Why isn't testing capacity limited to the number of tests that can get results returned within 72 hours, as we're hearing frustration with the idea of waiting a week to get results?
Yeah, it is a really important question, and it is one of the reasons why our partnership, the state's partnership with Exact Sciences and Promega, has been so critical, because one of the things we have been able to do here in Wisconsin is to keep our testing turnaround times at a place that those tests are still actionable, to Dr. Frieden's point, right? The farther you are away from the test result until you have it and can start action, public health action on it, the less helpful that is. I think the other important thing to remember is, if you are tested, you need to isolate until you get your test result, and right then there are actions that your public health, your local public health officer will help guide you through. But once you get tested, you need to take the action of isolating yourself, of keeping yourself away from other people to limit and stop the spread while that test result is pending. But we have been very successful with building a statewide lab capacity that is predominantly in-state. We have relied much less on labs, national labs like Quest and LabCorp and others, that when particularly the southern part of the country was seeing large surges, where that workload, that number of tests that was coming from those states was really making it difficult for them to turn around tests in a time frame that was actionable. But we have, through Exact and through our clinical lab network that the state lab has really helped to develop and provide technical assistance to, so that we have 115 or so clinical labs around the state that are doing tests, as well as this capacity with that Exact partnership. We have worked really hard to build as much in-state capacity as we can, so that we are not subject to turnaround times that are out of our control, and subject to surges in other parts of the country that are also tapping into those labs. And so it is a focus of our work. It will continue to be a focus of our work, particularly as we are seeing this surge here in Wisconsin. We need to be watching and maintaining good turnaround times for testing, but it is something that we have really tried to make a priority, and I think have done a pretty good job of maintaining turnaround times that allow actionable public health to be actionable on that test result.
Yeah. If I could add one thing to that, I totally agree with the spirit of the comment that we have an urgent need for rapid turnaround times. But I think I would disagree, and I think it's overstating to say that tests are useless if they take longer than that. I wouldn't want anyone to get the idea that if a test with a rapid turnaround time isn't available, that it's better or just as good to not get tested at all. Because there are situations, people who are in quarantine, who have been exposed, where knowing their status, even if it takes longer, is worthwhile. Because that's how we understand who is at risk, who's been exposed, and how we understand transmission in the community. So a test with a longer turnaround time than 72 hours is definitely suboptimal, but it's not useless, and it's better than no test at all in many situations. So that would just be the response to that specific comment.
Thank you, Jonathan. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie?
Hello. My question is, why is Wisconsin doing so much worse than the other Midwestern states?
All right, I'll start with that one.
And I'll jump in too, but go ahead.
All right, so I think this fundamentally stems from the ruling in mid-May that restricted many of the tools that we have to mitigate this disease, and we have seen our sort of a slow burn here in Wisconsin that never reached a low enough level to really make us comfortable about where we were with this outbreak. And we had some surging in July that particularly our partners in Dane and Milwaukee County did exceptional work in using their tools to mitigate and reduce what we were seeing in those numbers. And then with the return to campus and the impact on campus communities, and now the wider transmission across age groups in communities all over this state, is about the fact that we have fewer tools, and that absent understanding or becoming tired, the COVID fatigue, the just general sick of this thing that we're seeing, we need people to double down on their adherence to what we all know are the right and best practices as it relates to slowing the spread. But absent the tools that we had at the beginning of this pandemic, we are left with persuasion and word of mouth and goodwill, which we are certainly urgently calling use to help do the right things to stop the spread. But Governor, whatever.
Yeah, and I would just add on to that. Indeed, the decisions made by the Supreme Court had a role because it created opening up of our economy at a rate that was unparalleled by any other state across the nation. But in addition, as a result of that, we've been relying on goodwill of people for months and months. And people in Wisconsin do have goodwill, and many of them are doing the things they need to do in order to stay safe and keep their friends and neighbors safe also. But when you have, and of course this is going to go to the politics of it, but I have to say it, when you have leadership at the top that is continuing, even to this day, somewhat inconsistent with the severity of what this is. We're rounding the corner, it's a hoax, it's a big deal, it's not a big deal. That sends a message that what we're trying to accomplish is baloney, and it's not baloney. We're seeing it. We have people being tested, being found positive for COVID-19 at huge numbers. We have people dying here. That's not phony. That's not a hoax. And I think having more consistent messaging right from the beginning, right through today, it would look different, because our state has been relying on very little mitigation. We've been doing a great job with testing and contact tracing, and the other things that go along with that, having the right equipment in the right places at the right time. But at the end of the day, we need compliance as much as we can on issues at work. And when you have leadership saying some things that are the opposite to that, it makes it just damn hard.
Thank you, Sophie. Now to Molly Beck from the Milwaukee Journal Sentinel. Molly?
Hi, thanks for this call. We're hearing reports about COVID-19 patients and other kinds of patients being turned away or waitlisted or diverted from hospitals, especially in places like Wausau and Green Bay and Shawano. Is this the case, and what is being done to address it?
Dr. Westergaard can speak to this as well, but the part of surge planning that that hospitals and hospitals in counties and regions do together is around the transfer of patients, the sharing of workload, the sharing of staff. And so we certainly know and expect in situations where hospitals are having capacity stressors that they will employ some of those strategies with their partner hospitals around the region to make sure they can treat everyone that is coming into their care, or make sure that care is received again with one of their partners. But I certainly have not heard about patients being turned away or not provided care. But I would let Dr.
That would not be consistent with sort of practice in the state, having someone turned away. Sometimes if someone meets criteria to need to be admitted to a hospital, if a hospital is full, they may divert them to another hospital for an appropriate level of care. But that's not the same thing as what you would say being turned away or not receiving care. I haven't heard of any examples of that and would be surprised. But I think Secretary Palm is right that sometimes there is a mismatch for where a lot of disease activity is and where hospital capacity is, and that's totally, even before the pandemic, a common practice is to try to find the right level of care, given that some hospitals might have insufficient capacity.
Thank you, Molly. Now to Latoya Dennis from Milwaukee Public Radio. Latoya? Latoya Dennis? And we'll move on then to Mackenzie Amundson from WBAY TV in Green Bay. Mackenzie.
Hi there. Thank you for this call. Door County Public Health just announced this morning that their contact tracing efforts are significantly strained by an accelerating number of COVID-19 cases, and they will no longer be calling close contacts of a confirmed positive case. What are your thoughts on that, and what is being done at the state level to maybe bolster some of those efforts at a local level?
So I think a couple of things. One, we are seeing local public health around this state being overwhelmed by the numbers of new cases that we are seeing on a daily basis. And so, one of the things we have done, sort of in the design and framework of the contact tracing system that we've built, since March and April, we provided money to local public health departments to hire contact tracers. We at the state level have hired contact tracers in a surge capacity, as a surge capacity function, and we work on a regular basis with local public health so that they can request those resources from us should they not be able to meet their needs at the local level. But I will tell you, we in our surge capacity at the state level are needing to hire more people. Our workload is tremendous as well as we try to back up local public health to meet their needs. And so the system as a whole is absolutely maxed out right now. I don't know specifically about Door County and whether they requested assistance from us or whether we need to, call them after our time with you here today and figure out what's going on and make sure they have what they need. But the design of the system, again, still needing more staffing, needing more resources right now, considering the great number of cases we're seeing on a daily basis, was designed so that we could help provide backup to locals when they're in situations where they can't get to all of their investigations themselves.
Thank you, Mackenzie. Now to Lee Mills from NBC 15 in Madison. Lee? NBC 15?
Hello? Oh, I'm so sorry. That took me a second. I hit pound instead of star. My question is regarding the number of deaths that were just reported during this press conference. I believe this is the highest death total we've seen in months, single day deaths, that is. With the rising cases, should we expect the death toll to start increasing again? And if so, how soon?
The rise in cases, particularly as the increased transmission affects larger populations, is likely to result in an increased number of deaths. How soon and how high is really up to us. I think this question points to the fact that we are in a crisis. The previous question about health departments not being able to notify people who are exposed tells the same story, that we are in a crisis right now. Turning the corner on this requires that we do things dramatically different than what we're doing. It requires all of society, all of Wisconsin, to do things differently to reduce the transmission. It is possible, knowing what we know about respiratory viruses that get increased transmission as the weather gets colder. This is a virus transmitted similar to influenza and other viruses. The incidence tends to go up when it gets colder. We're setting records now at a point which is the beginning of respiratory virus season. The likelihood that this is going to get much worse before it gets better is a real one. And if we do nothing differently, I would say it's a high likelihood that this is going to get much worse before it gets better. So it's really on us. This is no one's fault. This is what the virus does when you let it do its thing. This virus is highly transmissible. It spreads from person to person very effectively. And when it gets into a person who is vulnerable to severe infection, it can cause severe illness, hospitalization, and death. We can expect more of that to happen unless we do things to flatten the curve. And I fear that the case numbers and the death numbers are going to get higher unless we do that relatively urgently.
Thank you, Lee. Now to Jeffrey Dada from Spectrum News. Jeffrey?
Hi, thank you for taking this call. I know you've talked about hospital beds and resources a few times, and you've talked about the trends that we're at. I don't know if you can give us a little bit more of a specific. How close are we to some of the concerns that we see in Northeast and Central Wisconsin about hospital bed capacity? Is that something that could be coming up? How soon could those issues be coming up?
Yeah, I mean, I think, the governor and I had the opportunity to spend some time with some of the CEOs in the Northeastern region this morning to talk about some of these issues and the work we can do together. And they are not surprisingly increasingly concerned about their hospital capacity and their ability to treat people with COVID and non-COVID. Right there, people are still having heart attacks. People are still getting appendicitis, or other sorts of things that need treatment that shouldn't be delayed because there are health consequences for delaying those kinds of treatments or surgeries. And so the toll on those systems, particularly when you're seeing some staffing shortages as staff are exposed to COVID-19, make their jobs increasingly difficult, and as you suggest, particularly in the Northeast region of the state. And so, I think Dr. Westergaard said it perfectly. Now is the time to urgently do what we need to do to flatten the curve, and that is work that we need to do so that we don't get to the point of needing to open the alternate care facility and provide that backstop if our hospitals become unable to deal with the workload that they're seeing.
Thank you, Jeffrey. Now to Katrina Lim from WQOW News in Eau Claire. Katrina. Katrina from WQOW. Okay, we'll move on then to Steve Prestegard from the Platteville Journal. Steve.
Thanks for taking my question, which is on a slightly different subject of this than others you've been asked. I've been told, and I've also read from school teachers and from administrators, that their students are having major problems with virtual learning. And in a lot of cases, it's students not doing what they're supposed to do as far as showing up and so on. Obviously, there are some school districts that are doing all virtual right now, may not be doing as well. There's others that are doing kind of a combination of virtual and in-person. And there's a dilemma, apparently, in some school districts that feel that their kids really need to be in school for in-person learning. That's the model for decades, obviously. But then there are the COVID numbers. What I'm wondering is if the state is doing anything to help schools to maybe make their virtual teaching more effective and other things to get kids more engaged, which also appears to be a major problem.
Well, it's difficult to encourage engagement of students from Madison when you live in Antigo. But I will say this, it was the Wisconsin, we have provided a significant amount of CARES dollars to all the schools in the state. And in many cases, those CARES dollars have been tilted, the majority of the money have been tilted towards school districts that have children that don't succeed well in school because of all sorts of issues, including poverty and other issues that are impacting them. So the money has been sent to the schools. They've worked very hard to make sure that their remote learning is done appropriately, and making sure that it's highly engaging. And I know the teachers are working as hard as they humanly can. But at the end of the day, There are, in any class of 25 or 30 kids, there's going to be some that are disengaged in the classroom or remotely. But I think overall, I don't know of a school board or a superintendent or teachers that don't agree that, they do all agree that it is best to have it in person. And that's what they're all working for, whether they are doing it in person and, struggling with a small number of people getting COVID-19 and having to go through the quarantine and all that, or they're doing it all remotely. So frankly, as governor, I'm not in a position to criticize the hard work that's going on, but I will say there was a significant amount of dollars that were allocated to the schools this summer by the Department of Public Instruction through the federal government to have school districts beef up their remote learning.
Thank you, Steve. Now to Hillary Mintz from WISN TV in Milwaukee. Hillary?
Yeah, hi, my question is for Governor Evers. Given the record number of cases we're seeing, obviously people are not listening to the warnings. Why do you think that is, and what can you do about that?
Well, we could fine everybody $500, or $200, which is in state law. Frankly, there isn't enough law officers in the state to go out and arrest and hold people accountable. At the end of the day, people have to understand that this is important. We have hospitals in Northeast Wisconsin that are close to capacity. We have the largest numbers ever. We're increasing, if we have large numbers of people that are determined to be COVID-19 positive, we're going to have increases in the number of deaths. So whatever I can do as governor, or whatever we can do as state government and local government, I know the health officers in the 72 counties are gnashing their teeth about this very, very issue. We have to have people that believe that this is not a hoax, that this is a real thing, and that people are dying from this disease. And it's unacceptable that we just blow it off. We need leadership at the national level that are consistent in this effort. But yes, we could probably throw people in prison, I guess. But obviously, that's not the answer. Mitigation is important, and only we can do it. Regardless of the laws or the fact that there's a $200 fine, all that doesn't matter. What matters is what's in people's hearts and minds, that they believe that this is an important issue. If they're going to a rally where there's going to be 6,000 people and no one's wearing a mask, or very few people are wearing a mask, that's a problem. How do we resolve that? We have to have people in charge talk the truth, and that's really important.
Thank you, Hillary. Now to Lauren Linder from TMJ4 in Milwaukee. Lauren?
Hi, can you hear me? I
Yes,
just wanted
we
to
can.
make sure. So I just wanted to ask the question. I know you've talked about hospitalizations a lot, and I know, Secretary, you mentioned we're getting closer than ever to using the state fairgrounds alternate care facility. You mentioned that in terms of shortage of healthcare staff, but obviously we've also talked about surges in hospitalizations. What areas are you seeing the largest surges in hospitalizations, seeing, as you're saying, these healthcare workers who aren't calling out of work? And why do you think that that's the case? And I was wondering, especially in the Milwaukee area, if we should be concerned with all of this.
So from our meetings with healthcare leaders, that describe that it is a staffing shortage that's going to be more acute than a space shortage. So the idea of running out of hospital rooms or running out of ventilators for severely ill patients is probably less of a concern than not having enough people to work and staff the hospital. And that's partly because there's disease activity in the community and healthcare workers get sick, it's also very important that people stay home when they've been exposed and when they've been quarantined. And while we do a very good job and have very robust standards of infection control in hospitals, people might be exposed to the virus in the community. So healthcare workers that have a family member or close household contact with infection really need to stay home. And if they are asymptomatic and exposed and come to work, that's what we call a crisis standard of care. There are situations where that has to be done, otherwise it's not safe for patients. But everything we can do to prevent transmission in healthcare settings is important that we do, and that involves excluding people from work if they have any symptoms at all, or if they're exposed to the virus, because people can be exposed to the virus, not show symptoms, and then at any time within 2 weeks, they can develop infection and spread it to others. So that compounds the interest, is that we need to do everything we can to protect patients, but that sometimes involves keeping healthcare workers from home when they're exposed, so that makes it more challenging.
Thank you, Lauren. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, this question is for Governor Evers. Last night, the Wausau School District announced that they'd lost around 450, give or take, students due to parents putting them in other schools due to they didn't like the decision of the school district to host online learning, which equates to about $3.4 million out of the school. So we wanted to know if there was any plan at the state level to help public schools address the lack of funding.
Well, that issue goes to the count date of children. That happens a couple times a year, and that's in state law. So in order to change that to advantage school districts that are losing kids like Wausau, we would need a change in state law, and that would mean lawmakers need to come to Madison to take that up.
Thank you, Mason. And our final question this afternoon belongs to either Danny Maxwell or Francisco Almanera from WKOW-TV in Madison.
Hi, thank you. We are hearing some Wisconsin National Guard members are moving from the Alliant Energy Center testing site to possibly other areas of the state to help with community test sites. We're wondering how many might leave the Alliant and where would they be deployed? Thank you.
So this is a really important question. It's actually an exciting part of continuing to build out our statewide testing strategy. And so we have a number of sites around the state that are currently staffed by the National Guard. And so while we expect the National Guard to no longer be with us after the end of the year, we are working with those sites. You mentioned Alliant. There are two in Milwaukee as well, where we are working as we should be, so that we don't see any sort of disruption in those community testing sites to shift the staffing from National Guard resources to local staff. So that planning and that transitioning will happen here over the next month or so, again, so that we have continued access, a smooth transition, and no gap in service for those community testing sites. I think the state, the important thing to know is the state will continue to provide the testing supplies for those testing locations, as well as the funding to those communities to support the staffing at the local level. But as you suggest, the goal is to transition these to local staff from the current wing or National Guard staffed infrastructure. The other thing we are doing as part of our planning and our work and our testing strategy statewide is to stand up and push more community testing into other parts of the state. We think it's really important that we have access and ready access across the state of Wisconsin to community testing. And so we are currently in very active conversations with counties and regions around the state to make sure that we have better access, better coverage, better spread of our testing resources so that more communities, more regions, more parts of this state have easier access to community testing. And so that work is very actively underway as well. And the Guard, as they have previously and will continue to help with the infrastructure, with setting those locations up, with giving technical assistance and doing the specimen collection, but with the goal that we are helping local communities to take those sites over and run them themselves in anticipation of the Guard no longer being with us after the end of this calendar year. So we're very excited about bringing new testing opportunities to other parts of the state, but recognize we have to build the infrastructure for our locals to be able to pick up the staffing function moving forward.
Thank you, Danny. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.